I've been working with patients with these kind of complex chronic pain and chronic illness conditions. What we were just starting to see was that so many things impact chronic conditions, whether it's environmental toxins, stress, heavy metals, poor nutrient sufficiency, or inflammatory diets, lack of exercise, too much exercise. And increasingly, the research is showing us that acute illnesses like infections trigger chronic illnesses. So, for example, Epstein-Barr virus can trigger MS. COVID can trigger long COVID. Lyme infection can trigger, long Lyme, if you will, or Lyme that doesn't resolve acutely. What I realized was that by the time my patients were coming to see me for perimenopause complications, it wasn't just all related to the menopausal transition. It's the menopausal transition on top of their underlying chronic health vulnerabilities.
Welcome to Salad with a Side of Fries. I'm your host, Jenn Trepeck, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. Welcome back to Salad with a Side of Fries. I'm Jenn Trepeck, your host and health coach, here with you every week for Wellness Without the Weirdness. And I think if there's a health topic that is taking over and, becoming more mainstream, it's menopause and perimenopause. And we've talked about this phase of life before. We have quite a few episodes coming up on it too in the next couple months. But today, we're going to talk about the intersection of menopause or perimenopause and chronic conditions, because each one individually can feel like a behemoth, and then together, I know it can feel insurmountable. So trust me, it's not. And we have an incredible expert here to share more with us. She's a leading expert in women's health as the founder and CEO of the Integrative Women's Health Institute. With 25 years of clinical experience in her menochronic program, she specializes in supporting women ages 35 to 55 through the perimenopause and menopause transitions who struggle with underlying chronic conditions such as pelvic pain, endometriosis, post-viral syndrome. So think like long COVID, right? Autoimmune issues. And really, it's through health coaching, integrative, and functional medicine that she makes a difference. She's a licensed clinical nutritionist and physical therapist and a board-certified women's health coach. She's the best-selling author of Outsmart Endometriosis and Clinician to Coach, Secrets to Building Your Successful Health Coach Practice, offering practical strategies for health and wellness practitioners. And joining us today to help all of you, without further ado, I give you Dr. Jessica Drummond.
Thank you so much for having me. That is a very kind introduction.
You're welcome. I'm thrilled to have you. And I think it's also worth sharing for everyone. So back in December of 2024, I was on your podcast with my colleagues. So some of you guys know I have a few ventures in the wellness space, one of which is the no-to-nose method for chronic pain. And so myself and our co-founders, we were on Jessica's podcast called the Integrative Women's Health Podcast. So everybody, when you finish listening today, pop over. That aired December 17th. So we called it Innovative Approaches to Chronic Pain with the No-to-Nose Method team. And that's the Integrative Women's Health Podcast. So another one to add to your list, everybody.
Yes, great. Really great episode for sure.
Yeah, and hopefully, changing the state of things for sure. That's the plan, right? And Jessica, we didn't hear a ton of your story in introducing you. So I want to start with that, and then we'll dig into everything, chronic conditions plus perimenopause and menopause. Really quick, though, one more housekeeping item. We'll tell our members what they're getting this week. So members, your recipe this week is for roasted vegetable salad for hormone balance. It is a whole meal in a bowl, beyond satisfying. This one could end up being a staple of your routine. And the hormone balance part is just a nice bonus given the nutrient density of all of these ingredients. So if you want this recipe, be sure you're a member. Go to glow.fm/salad with a side of fries. For just $10 a month, you get weekly recipes, a monthly article or tool, extra discounts from me and our partners, plus access to live Q&A sessions. It's a total deal. I say it all the time. It's a steal when you take advantage of the full offerings. you save far more than that $10 cost. A no-brainer way to show yourself that your health is a priority. Your membership also supports this podcast and this community so we can continue to bring you new episodes every week. All right, remember, you're going to glow.fm/salad with a side of fries, or just click the link below in the episode notes because that's a whole lot easier. Once you're there, you click the little I agree and then support now. Enter your email and payment info, click subscribe, and you're all set. You'll get this week's recipe for the roasted vegetable salad for hormone balance. Okay, Jessica, so you started in physical therapy, then added all the health coaching to your practice, and you have this specialty of, women with chronic disease. So how did all of this come to be?
Well, I started my practice actually back in 1999. I graduated as a physical therapist, and I worked in orthopedics and sports medicine initially. I was an athlete as a kid. I was a standard, high-achieving first daughter, all the stuff. And I was a gymnast. And so I thought I would do sports medicine, which I did initially, and I really enjoyed that. But I began to specialize actually in women athletes who were either pregnant or who ended up with breast cancer and then had breast cancer surgery and had, shoulder impacts. So in physical therapy, there's a lot of interconnectedness between orthopedic and musculoskeletal movement and fitness and women's health because, female athletes all the time get pregnant. And pregnant women are always trying to figure out what's safe to do from an exercise standpoint. And then I began to move my practice in the direction. I did a wide range of women's health and pelvic health for men and women, people of all genders, for many years, and realized that the area that was most challenging to fully optimize were people who had chronic pelvic pain, related to things like endometriosis, vulvodynia, bladder pain syndromes, all kinds of chronic pain that would impact pelvic health. And around the same time, so my oldest daughter was born in 2003. And so I was, 4 or 5 years into practice, and she, I had an easy pregnancy. I was super fit. I was working essentially the whole time. I was on bed rest a little bit briefly in the end of my pregnancy. But then my recovery was rough. and, just like anyone else, it's interesting because even as a health professional, I had no idea what I was getting into. And despite the fact that I worked with pregnant and postpartum women, the fatigue that I dealt with postpartum, chronically getting sick, and I had to kind of go down a rabbit hole of where we had sent our, quote unquote, difficult patients in my years as a clinician, because I just didn't understand why I wasn't just bouncing back from this pregnancy, but I was still trying to for many years. And I just kept getting sick and had all this fatigue and then anxiety. And later I realized I had essentially what we colloquially called adrenal fatigue, but I had a chronic fatigue condition related to a viral reactivation, probably. Because when I was in high school, I had mono twice. And what you aren't really told, or we certainly weren't told in the 90s about Epstein-Barr virus, is that essentially once you have it, and most people do have it, it remains in your body as a dormant virus. And this is true for essentially any herpes virus. So 95% of people have Epstein-Barr. As long as it's kind of quietly hidden, it's probably not bothering you. But many things can reactivate viral infections, any stressor really. So I've seen patients whose divorce reactivated it. In my case, it was pregnancy and giving birth, and then my oldest daughter not sleeping for 6 years. And so, the stress of that, and more commonly now, one of the biggest activators of long COVID is that COVID infections awaken other herpes viruses, especially Epstein-Barr is one of the most common ones we're seeing, but we're seeing other things too, like Lyme, which is a bacterial infection, CMV, which is another herpes infection, shingles, all of it. So back to the early 2000s is when I discovered integrative and functional medicine, because I needed it to heal from this chronic fatigue type syndrome. And what I learned was that really in my kind of traditional physical therapy training, nutrition was not emphasized as a healing tool. It was more like you needed adequate nutrients to perform certain physical activities, but we didn't really think about it from an anti-inflammatory standpoint. We didn't think about nutrient optimization. We didn't think about herbal tools to regulate the nervous system or optimize the neuroendocrine system, which is like the foundation of your hormone system. We really didn't even talk about blood sugar back then, metabolic syndrome, because it was much less common than it is now. And what I really had to do in, those early years as a young mom and eventually going back to work in physical therapy and women's health was I had to reassess my relationship with nutrition and exercise and kind of my type A-ness.
Yes, we laugh because we know. Yes.
Yes. And so it's still, honestly, there's certain things about your personality that are difficult to overcome no matter what. And so it's still a constant work in progress. But I took back that learning because many of my patients with chronic pelvic pain, with endometriosis, imagine many of you probably experience endometriosis because it occurs in 1 in 10 women. Vulvodynia is very common as well, PCOS, bladder pain issues. So if you're not experiencing this, which you commonly could be, imagine that you start experiencing chronic pain either with your cycle or kind of any time, starting when you're 8, 9, 10, 11, 12 years old. You learn to power through that pain. And, everything you and your team do at a No-Dose Method is a similar perspective. Like, you have to unwind your learned response to the gaslighting, to just the fact that you have to kind of keep showing up and taking exams and, going to softball tryouts. Or, my daughter has some pelvic pain and she's an actress. She loves theater. So she had a musical theater production the other night, like on the first night of her period. And she was like, oh. So, fortunately, she has me as a mom and we have red light and supplements galore. But,
Yep.
Still as a teenager, this was your first experience. And many of our patients at that time, these surgical techniques were not as good. So they might have had 15, 20 surgeries in a lifetime. Many were addicted to opioids. It was a very difficult landscape for chronic pelvic pain and chronic pain in general. So I started to apply the perspective of functional nutrition to my rehab practice. And then eventually I went back and got a doctorate in clinical nutrition in 2017. And since about 2006 or so, when I initially launched the Integrative Women's Health Institute, I've been working with patients with these kind of complex chronic pain and chronic illness conditions because we didn't know it as well in the research then, but what we were just starting to see was that so many things impact chronic conditions, whether it's environmental toxins, stress, heavy metals, poor nutrient sufficiency, or inflammatory diets, lack of exercise, too much exercise. And increasingly, the research is showing us that acute illnesses like infections trigger chronic illnesses. So, for example, Epstein-Barr virus can trigger MS. COVID can trigger long COVID. Lyme infection can trigger, long Lyme, if you will, or Lyme that doesn't resolve acutely. And so in our current environment where 10% of women have endometriosis, which is in part a genetic disease, it's a genetic inflammatory immune condition, vulvodynia, PCOS, which is an early stage metabolic disease. About 10% of women have PCOS. 80% of women have some kind of chronic pain condition. At least 50% of women, maybe more, have an autoimmune condition. And essentially everyone in the world has had COVID at least once at this point. If they haven't had Epstein, 95% of have had Epstein-Barr, many with Lyme. So what I realized was that by the time my patients were coming to see me for perimenopause complications, it wasn't just all related to the menopausal transition. It's the menopausal transition on top of their underlying chronic health vulnerabilities.
So you've mentioned a number of these underlying chronic conditions, some of which might be laying dormant, some of which might be things that, people are actively pushing through, powering through all the time. And so what is it that we need to understand about the chronic, before we add, the menopause, perimenopause piece on top of it, in the chronic illness piece, what do you think people aren't understanding about it or need to understand about it to then understand what happens when we add
Perimenopause.
Life phase? Yeah.
Mm-hmm. So I think there's two things. One is that some of these conditions can be relatively silent, or we might not recognize what they are. So as an example, you could have endometriosis since you were 10 years old but never know that either your hip pain was related to your endometriosis, or the fact that you had one miscarriage was related to your endometriosis, or that some period pain occasionally was related to your endometriosis, because some people don't have very severe symptomatology of endometriosis their entire life. And the same thing could happen with any infection. You might have had mono as a teenager and then fully recovered from it, as far as you know. And then perimenopause itself, the shift in estrogen, maybe you have a little bit of metabolic vulnerability, and then your estrogen levels start kind of moving all over the place. That is a form of a stressor that could activate any underlying conditions and sort of make them worse. That maybe they were quietly a part of your life, but they didn't really bother you. And now all of a sudden you can barely digest food and you're hardly sleeping. And just like all these symptoms seem to be flaring out of nowhere. Now, some of those symptoms could be directly related to the perimenopausal hormone shifts, but some of them could be related to kind of like an awakening of relatively quiet underlying chronic conditions due to the stress of navigating perimenopause physiologically. Does that make sense?
Yeah, for sure. And, the piece that I think is so frustrating for people is because each one individually feels unpredictable and a little bit of like trying to put the puzzle pieces together, and then you put one on top of the other and you're like, I don't even think these are pieces from the same puzzle.
Right. Or like, why is this puzzle so complicated? So yeah. I think the other problem, so there's two other problems. Two other problems are that, one, any kind of vague women's health, all these things are kind of labeled.
In air quotes, yeah.
Right. Women's health, chronic illnesses are automatically like dismissed by almost all of traditional medicine. And even functional medicine, I think, has kind of gone in the direction of, well, if you aren't doing all the things perfectly, then whatever symptoms you're dealing with are kind of your fault.
So annoying.
Yeah. And so this is one of the reasons why I love your podcast, like salad with a side of fries, because the reality is that we can be doing all the things, right? I think you said, there's a lot more information about perimenopause and that women need to be lifting heavy weights and need to be eating protein and need to be getting sunlight in the morning and hydration and going to bed and no blue light and yada, yada. And I think women, by and large, who have this information are trying to do it, but integrating that in a low stress, nervous system regulating way into their already crazy busy lives can feel very overwhelming. And then if you layer on top of that, they have to have all of this complicated functional testing and they have to take 16 different supplements. I think we have to be really mindful about the stress of that. And then on the opposite hand, if you're using the conventional system and trying to get some of your healthcare paid for by your insurance, any of it would be nice. Then each physician or each silo, each practitioner you see in the medical system is like, well, I can only deal with your skin, or I can only deal with your hot flashes, or I can only deal with your digestion. There are very few practitioners who are really looking at the whole system. And so I think what we have to start thinking about is, as individual women navigating perimenopause, we have to have this awareness that, it's probable that we are not in perfect health as we enter perimenopause. And, for some women, they more or less feel like they are, but they might have just migraines, or they might know that they need more recovery from their workouts, or, they may have something. So any vulnerabilities could be exposed by perimenopause. And so it's a time to seek practitioners who are calmly and patiently helping you navigate the holistic experience of perimenopause, because a lot happens on a mental health level and on a physical health level. And you're also kind of going through puberty in reverse. So there's a lifestyle conversation to be had about, okay, now you have your next 30 years. What do you want that to look like in terms of your health so you can do what? So there's a lot of transition going on. And I think women need to think about working with a health coach who's very skilled in this area would be a great place to start, to just start to pull together. Like, she has to think of herself as the leader of her healthcare team, because there isn't really like a social worker for the perimenopause transition, but the perimenopause transition exposes all of the undercurrent of vulnerability in a woman's life, from her relationships to her physical health.
I love this, not only because am I so passionate about this idea of a care team, right? That's really what we're doing with the No-to-Nos, but also empowering all of us to understand why what we're experiencing is so complicated, right? Why it feels confusing, because I love the way you just put it, that it's sort of exposing some of these underlying things that may have been laying dormant, that may have been the things that we just brushed aside or pushed through because it wasn't at that time, really standing in the way of us, doing the things that we want to do. So I want to shift into, you started to talk about like that perspective shift and rethinking some things. So I want to go down that path a little bit more about all the things that we can do. Really quick though, let's pause to highlight our partner for this episode. Big thanks to DNA Miracles for supporting Salad with a Side of Fries. Because every child is a miracle, DNA Miracles provides the highest quality body and wellness products designed for babies, children, and expectant mothers. All products are gentle, easy to use, and 100% effective when used as directed. DNA Miracles partner with leading health professionals and scientists who follow the highest standards in ingredient selection to create the most effective skin, hair, and health solutions. As natural as possible, DNA Miracles is the best and safest option on the market for you and your little miracle. From expert pediatricians to real family testimonials, everyone has fallen in love with DNA Miracles. So as we're discussing in this episode, sometimes we need a little additional support, right? And the truth is, the littles in our lives do too. So DNA Miracles has options to support your child's needs. It might be the DNA Miracles chewable probiotic. Each tablet delivers 5 billion bacteria. It supports immune health, a healthy GI tract, healthy teeth, and gums. I use this one too for myself, for my gums. Awesome. Also great if you are out and about and eat something that you're afraid is going to give you bad breath. So the chewable probiotic is just $37.95. Or maybe it's the DNA Miracles Essential Omega-3 with 800 milligrams of DHA and EPA and a delicious creamsicle flavored, drink for your kids. I promise you they're going to ask for it. It tastes so good. That one is just $39.95. All these prices are before your 10% off and free shipping for being a Salad with a Side of Fries listener. To get 10% off and free shipping on your order, text the word MIRACLES, MIRACLES, to 844-947-4846. You'll get the link and coupon code right to your phone. Again, simply text the word miracles, MIRACLES, to 844-947-4846. This is a toll-free number. Standard text and data rates may apply. Okay, so Jessica, as we're talking about this, and we think of, in more functional spaces or in wellness spaces, right? We think of different systems of the body. And essentially, what we're experiencing is kind of the interplay between like neuroimmune and endocrine health, right?
Yes.
So when we're dealing with all of these things, playing together, where do we start?
That's such a great question. And the good news is actually you can start in any of the areas where it feels easiest. So if we think about the physiologic systems, because they're all kind of talking to each other, there are many ways to start this healing journey. And so we can start with what feels easiest for you. So I've had, for example, clients that have, 4 kids, their husband travels for work, they have a full-time job, a lot going on. I had one client who made dramatic improvement over about 6 months by simply adding one night a week. She asked her care provider to stay a little bit longer and put her kids to bed. And she went to a meditation class. So you can start with literal kind of direct brain nervous system regulation through mindfulness, through vagus nerve toning, through breath work, through yoga. You can start directly in the nervous system. The more calm and regulated the nervous system is through more of the day, the less reactivated your immune system will be. So what we do is we start our clients tracking their heart rate variability with like a fitness watch. There's lots of different ones that we can use. But women often find that for 30 years, they've been living in freeze state or fight or flight. They're kind of always in a what we call calm aliveness. And getting to that calm aliveness is a practice, because otherwise, like if you're scrolling or you're working or, your kids are stressing you out or you're running late, you're not in that healing nervous system space. So that's the foundation. But if you're like, oh my God, I can't meditate, like I'm super stressed if I don't even have my phone near me, like I just can't do it. We can get there in different ways. So for some people, it's movement. Maybe they take their dog for a walk without their phone or without looking at their phone. For other people, it's actually nutrition, because if we feed the gut microbiome and the enteric nervous system, which is the nervous system in your gut, nutrient-dense, antioxidant, prebiotic, high fiber, high protein food that actually sends signals to your nervous system that your body is safe, and so it's able to start healing. So we can address the healing piece in a lot of different ways that actually don't have to be very complicated, but what they do have to be is consistent. And that's where it gets tricky. So instead of feeling very overwhelmed with having to make a lot of changes in your life, making a few targeted changes with the support of a health or wellness coach consistently over time. Like you want to think about making these changes kind of forever. And I feel like age 50 is such a unique turning point, because if you think about the 30 years of age 20 to age 50, or at least early 40s, you have the support of estrogen that metabolically allows you to get away with a lot. So
Yeah.
I have a 21-year-old daughter, and, she's very healthy. She grew up in my house, so she was eating very well and all of this, but she's been in college for 2.5 years now. So certainly staying up too late a lot, drinking too much, all that stuff. And and I was the same way. Like, it doesn't really affect you in your 20s in the same way that it does when you're 50 and above, or even 45 and above. And I think, and that is because the cumulative effect of these environmental and physiologic stressors but also the loss of the protective kind of metabolic support of estrogen. And so here's the good news. We actually do have essentially the tools and understanding to have your body, unless you have a really severe chronic illness, long COVID, Lyme, those are a little bit more difficult to navigate that we have to keep supporting. Even endometriosis, especially if you've had to have surgery or if you ever had cancer, then it's a little bit different, but it's similar. We have all these tools and understanding to kind of keep your body in like an early 40s physiology, even into your 70s. Like women in their 70s can now lift heavy weights, can hike, can play with their grandchildren, even early 80s. We have some women doing some pretty amazing things from a fitness standpoint. But how you have to address your health 50 and older is very different. You have to be really thinking about your metabolic health, which with almost every meal. Does it mean you have to eat like perfectly? No, but you do have to be really emphasizing nutrient-dense foods, strength training, walking, hydration, circadian rhythm, sleep quality. You really have to think of yourself as more how you might think of yourself if you were an athlete, to just do the same kind of things that you want to achieve in your 50s. Does that make sense?
Totally. I was thinking the same thing of like, oh, like an athlete,
Mm-hmm.
Can I go back? Because there was a couple things that I wanted to ask more about. One of those pieces is the heart rate variability.
Mm-hmm.
So we did a dedicated episode with a heart rate variability expert a couple months ago, but I'm really curious to hear from your perspective because different devices, they'll give you a number, but their assessment of that number is kind of different depending on their software, or it's so individual that what are some of the things, especially in this phase of life, that when you're helping somebody understand their heart rate variability and what they're looking at, like what are some of the guidelines that you have them look for or think about?
So what heart rate variability is this the amount of time between heartbeats. And you might think it's a little counterintuitive, but if the variability in the amount of time between heartbeats is higher, so let's say it's like 1 millisecond, then 3 milliseconds, then 5 milliseconds, then 7, then 2, we want it to kind of be all over the place in a millisecond number.
Yep.
Because that shows that your nervous system is in that calm, rest and digest, parasympathetic dominant space. That's the healing zone of the parasympathetic nervous system. The way I like to think about it is, we all know of that one 97-year-old who's like, I smoked and drank and I'm fine. Those people are exceedingly chill.
Mm-hmm.
And so that's what we're going for. You can get away with more if you're in that exceedingly chill zone. So certain devices will give you just a number, like your overnight average is 32 or something. It doesn't really matter what that number is as long as you're improving it over time. It's a competition with yourself. So ideally, we want this number really high, like in the 70s, 80s, 90s, 100. But most women that I work with, when we start out, they're maybe in the 20s. We want to get them to the 30s, maybe the 40s. We want overnight for them to hit some of the higher numbers. Not all of the devices that we use will actually give you the raw data. It'll give you a stress score sometimes. So staying in the blue or the low stress zone is really what we're looking for. So think of it as a personal best rather than a particular number that you're trying to hit.
Yeah, and everybody can go back to our episode from February on heart rate variability, where we also talked about some of the things that we can do that improve our heart rate variability specifically, with nutrients and sleep and all these other things too. And then the other thing that I wanted to go back to is you talked about consistency, which is so, I would say, consistency is key, king, queen, whatever, phrase you want. And this idea of, habits and rituals that we hold on to. And you talk about burn and bust systems. Will you speak to that a little bit because I think it's a helpful framework.
Right. I think what happens for people who are those kind of type A, you grew up, you were the good kid in school, you achieved at work, you were an athlete, whatever. There were these time frames of like push it really hard until you burn out and then just crash. Change that relationship with our body and with work. One of the things I find that women in their 50s who do have a lot of these chronic conditions is that they never learned the art of rest and recovery. So a couple years, maybe less than a year ago, I watched this documentary about a bunch of NFL quarterbacks. And it was like the perfect analogy for this because I think his name is Patrick Mahomes. He's like the quarterback for the Chiefs. So they were going through kind of what a week in his life is during the season, right? So a quarterback of an NFL team is going to get literally hit by a car multiple times every week, for 2 hours or however long it takes. So the following week, there's this whole phase before he starts training again, lifting again, sprinting again. There's deep recovery. There's people there like literally feeding him for certain food. He's in a hyperbaric. He's in a cold plunge. Like how he trains is differently. He's doing mobility and low load lifting. One of the things that I think the boom and bust education of young girls and women never taught us. It taught us to achieve and push and power through. It never taught us how to have deep recovery. That was always seen as kind of luxurious, like, oh, you went to get a pedicure or something. But like, we have to do as much deep recovery as we do heavy lifting. And especially from a nervous system perspective, what my clients really struggle with is sitting quietly. Especially because we're so practiced in dopamine-addicted distraction. It's really a skill set to be able to sit quietly and not do anything, not reach for your phone, not worry about the grocery list. But that practice unlocks kind of a connection between the nervous system and the immune system that and the digestive system that helps us both absorb nutrients, but, fight off chronic viruses, heal from long-term chronic infections, reduce chronic inflammation, stabilize metabolism. But think about, the last time you just kind of like sat in your backyard and did nothing.
Ha! Right. I know.
Yeah. And so we keep telling women like eat more protein, lift more heavy weights, walk more steps. But we have to balance all of that with deep nervous system recovery. And that is the key to increasing your heart rate variability, which is just the measure of how often your nervous system is able to get into that deep repair state. The good news is that even in perimenopause, when your hormones are not consistent, so there's a great study looking at hot flashes. 2 groups of women had equal levels of estrogen decline. One group had more robust heart rate variability. The other group did not. This group that did not have the robust heart rate variability, had low heart rate variability, had hot flashes. The other group did not. So it's not only about estrogen. It's about the combination between how your estrogen is varying and your nervous system regulation. So while I'm very much in support of, hormone therapies because of the stressful environment like we currently live in, we actually wouldn't even need that if we were living in a much more calm nervous system state, which, I completely understand is very difficult to do in the current environment. But it's so important that at least how I would think about it is when you're 50, if you want to be able to hike or, go to your beach house with your kids or whatever, when you're 80, if you want to carry your groceries in from the car, you have to now start thinking about yourself as an athlete and tap into the recovery practices that allow your body's healing mechanisms to really be activated.
Yeah. And adding to that, I think we also make these plans expecting that perfection, planning for this optimal ideal day that never actually exists or ever happens. So putting these things in place such that they happen even on the days where we don't feel 100%, even on the days where nothing goes as planned.
Yeah, and I think that's very important when it comes to some of the symptoms related to this, because a lot of these kinds of complex interactions also interact with things like mast cell activation syndrome or dysautonomia. You might feel dizzy, you might feel hot flashy, you might feel energy crashy, you might feel flares of pain, of burning pain, of migraine. And it's not to say you should power through those, but I do think that there's some benefit to kind of riding the waves of symptoms when we know they're not dangerous, and we kind of work with our patients to help them figure out like when they're red flag symptoms and when they're just kind of like the systems are just talking to us, symptoms. And we do want to do what we can to mitigate symptoms, but there are going to be symptoms for a little while. I call this the upward spiral of healing, not the upward straight line of healing, because as you're healing, sometimes some of the symptoms are worse, sometimes they're better. We have to, and I think this is where the health coaching piece of it is so important. Sitting down with your health coach and really thinking about what does your life and your health look like right now, in 5 years, in 10 years, in 20 years. What are we training for? What are we healing for? That helps to prioritize what we actually have to do. So, for example, I had a patient once who had all of these things, right? And yet she still had a really robust volunteer calendar. She had almost no parenting help from her partner. She had a full-time job. I have another client who had kind of all of that, plus 4 or 5 kids. She owned a farm. Like, there's layers of things that women are doing that very rarely have they stopped for a moment and said, is this what I want? Or is this what I have to do to survive? Sometimes that's the reality. And I think we have to take a moment, look at our resources, and try to be really clear about what we need to do, what we want to do, and what we don't want to do or don't want to need to do. Because taking care of yourself like an athlete is time consuming. And so we have to be willing to let go of some things or recognize that our gains are only going to get us so far. Now, of course, tools like hormone therapies and supplements and, recovery tools like red light therapy and exercise can help amplify and expand our healing and our energy. But nothing is going to overcome a really extreme schedule that you don't want to do. Another really interesting study was looking at like caregiver burden when people were caring for others, and it was part of their purpose, was part of something that they wanted to do. It helped give them a sense of, not so much achievement, but just purpose and meaning. Yeah. Versus people who felt obligated to do the caregiving but did not find it meaningful. Those people were much less healthy. It was harming their health to do that caregiving. So we need to be paying attention. Really, a similar study was of 2 groups of cleaning people in the exact same hotel in the exact same job. One group was told to kind of put on like workout gear, and that this job is like, they don't even have to go to the gym anymore. It's a really, physical job. And the other people were like, be careful of how you lift. And, this is a really dangerous, difficult job. You're going to be exhausted. They had more back injuries. They were more injured, more exhausted, whereas the other people actually reduced their BMI, improved their resting heart rate. So how we approach our lives and taking deliberate decision-making about need for recovery and really learning to heal the nervous system and that integration between the nervous system, immune system, and hormone system is the key to having that long life that is more active and healthier.
I love it. I think that's the perfect place to, conclude the conversation for today. And I just want to go back to everybody thinking about that upward spiral of healing, So love that.
Yeah.
Excellent. All right. It's time for our rapid fire off-topic questions. You ready?
Yes.
All right. What's the best thing you've done for your health this week? What's the naughtiest thing you've done related to your health this week? Balance. Not that anything's really naughty, but
Yeah. I think the best thing I've done for my health this week was I'm really increasing my strength training. So that felt good. I don't know, naughtiest. I wouldn't even call this naughty. I would call this fun. Yeah. But my daughter and I on Sunday went to like a coffee shop and got a piece of cake and just kind of hung out and chatted.
Love it.
Yeah.
If you weren't the founder and CEO of the Integrative Women's Health Institute, what would you do?
I don't know. That's a great question. I think I would do something in AI. That really fascinates me right now.
I love it. Your favorite book on any topic other than your area of expertise, or you could give us a fiction book.
I read so many books. I'm right now kind of reading, I don't know, I've read a lot of fiction. I'm reading a book called The Lion Women of Tehran right now, which is really good. I don't know. I read a lot of fiction, but I can't pick one. I read them every week.
Awesome. I love it. If you could cure one ailment, disease, or sickness, what would it be?
ALS.
If you were a superhero, what would be your superpower?
Being able to stop time.
Ooh, that's a good one. What's your biggest pet peeve?
Bad tippers.
Agreed. All right, last one. In your opinion, what's the next frontier in wellness?
I think recovery. Peace.
Awesome. Dr. Jessica Drummond, thank you so much for being here. And for everyone to connect with you, learn more, listen to your podcast, the Integrative Women's Health Podcast. We will put links to everything in the episode notes down below.
Thank you so much.
All right, friends, on Friday in this week's Nutrition Nugget, bite-sized bonus episode, we're talking about Aloha bars. I don't know if you've seen them or tried them. I saw someone eating them and made a note to myself to take a look at them. And in my mind, there's no better time or place to do that than when we are together for a Nutrition Nugget bonus episode. So that will be this Friday. Be sure wherever you're listening, click the plus sign or the follow button, and your app will alert you when it goes live. And as always, everybody, I'm your host, Jenn Trepeck. Connect with me on Instagram or all social media. I'm at Jenn Trepeck, JennTrepeck. Website is asaladwithasideofries.com. Pick your platform, send a message. I love hearing from you, your ideas, your questions, your takeaways. This is also the easiest way to learn more about working with me as your health coach. Dr. Jessica Drummond, one more time, thank you again for being here.
Thank you so much.
Absolutely. And friends, if you are not already, join our membership program by going to glow.fm/saladwithasideofries. This shows your support for this podcast, this community, and your health. You'll get this week's recipe for the roasted vegetable salad for hormone balance. So until next week, remember, there's a connection between your nervous system, your immune system, and your endocrine system. And while certain phases of life can add complexity, you are not beyond healing. Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.